好，歡迎大家出席2019冠狀病毒病個案最新情況簡報會。今日出席嘅有食物及衛生局副局長徐德義醫生。
And Dr. Chang Chok Kwan of the Center for Health Protection, as well as Dr. Linda Yu of the Hospital Authority. We'll first hear from the Undersecretary. Citizens of Hong Kong, friends from the media, we see that there is a rebound of COVID-19 recently. Between the 5th and 11th of January, we have recorded 266 cases. Local cases, or those related to local cases, stand at 243 of them. Untraceable cases accounts for 32% of the cases. In the past week, that is between the 12th and 18th of January, we have recorded 381 cases. There are 365 local cases or those related to local cases. 33 of them are untraceable cases. In the past 2 weeks, asymptomatic cases account for about 33%. For this reason, in the past week, that is between the measures that are going to expire on Thursday, will be extended for another 7 days to next Thursday. Last Friday, we have made announcements on mandatory testing. In a specified area in Yamate and Jordan, that is, to the east Nathan Road, to the north Kansu Street, to the west Ferry Street, and to the south Jordan Road, any of the buildings in this area, if they have recorded one confirmed case in their units in the past 14 days, they will be included in CAP 599J in the mandatory testing notices. And those people who have been there will have to be tested. As at yesterday, 37 building blocks in that specified area has been included in the mandatory testing notice. And within the specified area, over 13,400 residents have been tested. We have conducted risk assessments. We've decided to expand the criteria based on building blocks under the mandatory testing measure. First of all, we would expand the mandatory testing operation in Yamate and Jordan. Within the specified area, there will be a designated core area. To the north, Pak Hoi Street; to the east, Temple Street; to the west, Ningpo Street; and to the west, Reclamation Street. We've considered that in the core area, there are buildings with appalling environmental hygiene, and there are also buildings that are without owners corporation, residents, associations, or management company. And there are more confirmed cases within this area. So all 70 buildings in that core area will be included in mandatory testing notices, whether there is any confirmed cases in that building. Secondly, we will also expand our mandatory testing to buildings with poor hygiene, or buildings with no resident association, owners corporation, or management company, or buildings with more, or areas with more cases. This evening, we will gazette to designate a specified area in Sham Shui Po, that is, to the northwest, Yuan Chao Street; to the northeast, Fuk Hua Street; to the southeast, Maple Street; and to the southwest, Lai Chi Kok Road. Similar to our approach in Yamate and Jordan, if in a period of 14 days there has been a confirmed case in any of those buildings, they will be included in the mandatory testing notice. And anyone who's been in these buildings in the past 14 days will have to be tested. Thirdly, under the funding of the government, the cross-disciplinary special team of the Hong Kong U will continue to conduct surveillance in the viral load in sewage in buildings. And within the Yamate and Jordan specified area, if any of the sewage sample has been tested positive, even without any confirmed cases, these buildings will be included in the mandatory testing notices. And in order to implement the mandatory testing notice, the government will extend the operation time of the mobile testing stations at Kwun Chong Sports Center all the way to Jordan Road and Saigon Street to the 22nd of January. Starting from tomorrow, there will be additional mobile testing stations being set up. These stations will serve free of charge all residents, whether they're under the mandatory testing or not. Those who are covered in the mandatory testing notices can also receive testings in these stations. In terms of prevention of imported cases, we will also strengthen our measures. Given the fact that there are cases of variants of the virus in Brazil and Ireland, we will gazette to restrict people who have been to Brazil or Ireland to board airplane to travel to Hong Kong. These measures will come into effect on the 23rd of January midnight. So any people who have been to Ireland or Brazil within 21 days before they board the plane for over 2 hours, they will not be allowed to board the plane. And those who have been to these places in the past 21 days, they will have to provide negative test results before they are allowed to board. We ask for your understanding. We all should all work together. Now let's hear from Dr. Zhang. We have 56 cases, number 9666 to 9721, 32 females and 24 males, aged between 2 and 95. 22 of them were identified in temporary testing centers. One was identified in Yamate Kwun Chong Mobile Testing Station. We have over 60 preliminary positive cases. About 30 of them are found in Yamate temporary testing centers or mobile testing stations. Of the 56 cases, there is one imported case. It's someone from Indonesia, a foreign domestic worker. On the 17th of January, she flew with GA876 to come to Hong Kong. Of the 55 local cases, 23 of them are untraceable. 10 of them live in Yau Chim Mong area. 32 are related to other cases, of which one is related to the Central Kowloon route. 31 of them are related to other cases. Of the 55 cases, altogether 31 cases live in Yau Chim Wang district. 15 live in the specified area in Jordan. Altogether, of the 55 cases, quite a number of them are South Asian people. 17 of them are Nepalese, 2 Indian, 3 Bangladesh. In Hill Fong House, there was an evacuation operation. Altogether, 24 people have been sent to quarantine centers. There is one case that is not Unit 13. There is one case which is a preliminary positive case. Is Unit 13. It's above the 12th floor. Experts are of the opinion that there is a risk of upward transmission. Well, last night it was Unit 12 and 13, and those living under 12th floor. Today, those who live above the 12th floor will have to be evacuated just in case.
Today, there are also some new buildings that need to be subject to compulsory testing. one with 2 cases, number 1 Temple Street. There are 3 people from one unit and 1 person from another unit. And there are 2 other buildings within the specified area, and it is on 197 Shanghai Street. There is 1 person from that building, and also in Waiching Street, Waiching Kok. So this is the preliminary information, and please wait for the updates for the details. Dr. Yu, please. As of 9 a.m. this morning, in the past 24 years, the hospital authority has noted 91 cases. In the past 24 hours, 2 more persons in public hospitals passed away. And as of today, 160 people have passed away from the virus. In the past 24 years, there are 42 patients discharged from hospital, and altogether 8,827 have been discharged. 639 confirmed cases are in 14 public hospitals, and in the Asia World Expo, 39 of them are in critical condition, 28 in serious condition, and 572 in stable condition. We now have 1,226 beds in the negative pressure ward. Usage 67%, and there are 678 negative pressure rooms with utilization rate of 74.3%. There is a cashier that has been preliminary confirmed, and she was confirmed yesterday. The last day of work was on January 17, and she worked in the Yaomate GOPC. And we have traced the origins, and this patient mainly worked as a cashier without having contact with patients. She wore a mask during work, and we do not see any close contacts, and we do not know the origin of virus. And also in NTE, there is also a colleague who worked in Shatin Hospital, and she is preliminary confirmed last night. On Friday last week, January 15th, she went to work on her last day, and we have traced her working hours. She wore masks during work, and she has no close contact with patients or other colleagues. The office has already been cleansed, and we do not yet know the origin of the transmission. We now move on to the question and answer session. Please identify your organization before you ask any questions. Good afternoon. I'd like to ask about the compulsory testing. Well, you've already set out a specified area, so why do you decide not to impose compulsory quarantine in that area and instead to draw up a core zone? What is the reason for drawing up the core zone? Would you also impose an order for them to stay at home? If not, then people are still going to leave their homes after testing, and that could also increase the transmission. So which 2 buildings will need to be subject to compulsory quarantine in Yaomate? The government has emphasized on principles and to try to test as many people as possible. We would like to wisely use our resources, and therefore we need to be focused. In the past 2 weeks, we have seen a surge in cases in Yau Ma Tei and Jordan within a short period of time. It may due to their profession or that they live in a close-knit community. And it may also be due to other factors, that being a very old area with poor management. And we believe that we should focus more in that area and to conduct more tests. We have completed 3 days of testing and found some new confirmed cases. We believe that with more testing in that area, some information is provided by the HAD because they are more familiar with the buildings in the area, and they know which buildings are old and which are 3-nil buildings. And as they have no OCs, no resident organizations, or also no property management companies, then you can see that those buildings may be quite poorly kept. And we believe that there is a need to request compulsory testing. So it will be much like a small focused testing area. The scientific team from the university has also been taking environmental samples. And if there are 2 or more cases identified within a short period of time, then those buildings would also be subject to compulsory testing. I'm sorry, the speaker is off mic. I'm sorry, the speaker is not coming through. Well, we need to balance the need. Well, testing is a strategy, but we need to use our resources wisely. We look at the potential risk, and as explained earlier, the HAD believes that there are still some more core areas within the designated area. And so we are going to first focus on the core zone. We will test this out and then assess and decide on the next step forward.
Sorry, speakers off mic. The speaker is not using a microphone. The interpreter cannot hear. The interpreter cannot hear. The speaker is not using a microphone. We have considered the results of sewage testing. Perhaps the Center for Health Protection will give you more information. We will give you the information later. In relation to the sewage virus surveillance system, it is a project of the Hong Kong U. The Hong Kong U team has proved to be very effective in their work in previous cases. So they will continue with this surveillance program by focusing on testing viral load in sewage to help us identify buildings at risk. I'm from Hong Kong 01. Just now you mentioned that you would like to use a more focused approach to identify cases. That's why there is this core area. Do you rule out the possibility of stay-at-home orders? Will there be sudden or last-minute evacuation? Because this will really cause a lot of inconvenience to residents. Now that there is the addition of core areas. It is an area with a lot of subdivided units. You can't possibly have a list of residents. So what about the effectiveness? In relation to the patient having run away from a residential care home, the person has been found in a Hong Kong-style cafe. Do you have any information about that patient's whereabouts? Would the people who have been in contact with that person been put under medical surveillance or quarantine? What about the 5 confirmed cases? Have you successfully located them yet? I think evacuation is not directly related to compulsory testing. A risk assessment will have to be conducted. If the CHP is of the view that residents staying there will not be safe, then they will start an evacuation operation. Compulsory testing is an order under which the people who are included will have to comply with. Yes, in that area, there are a lot of private buildings. Some buildings are standalone buildings without owners' corporation and no management company. A lot of work has been put into it. They've sent out voluntary workers to reach out to the community, people who speak the language of ethnic minorities, to do door to door, to make arrangements for residents to get tested. The work is still in progress. We'll try to find the cases as much as possible. Work is also spent on verifying contact information given to us. We aim to enhance the testing rate. Well, the person from Wan Lun Home for Elderly is contact. Of course, if that person turns out to be a confirmed case, then all people who have come into contact with that person will be close contacts. The person in white, I'm from Now TV. We see that there are cases in different districts. Would there be manpower increase to the various teams? If so, how much? I would like to ask about Hill Fong House. Yesterday, Professor Yun Kwok Yung said that there was no need to evacuate those living above 13th floor. Now you say that they should be evacuated. Do you think a wrong decision has been made? The current confirmed case, Unit 13, which floor is it? How far is it from other confirmed cases? Yesterday, environmental samples have been collected. Any of them positive? And yesterday, you said that there are 5 confirmed cases that cannot be located. How do you find them? They came to you, or how do you find them? There are about 40 people from discipline services who will be seconded to help us. When the decision to evacuate was made, it was in a situation when confirmed cases are below the 12th floor. But now we have identified additional cases. And to err on the safe side, we would evacuate those living above the 12th floor as well. For the 5 people, as far as I know, they are family members. They are a few stories apart, a few stories above that flat. The one in the black jacket, I'm from the Abu Dhabi. A question for Dr. Chang. He said that quite a number of confirmed cases are South Asians. What's the nature of their work? What is the transmission chain? I have a question for the Undersecretary. You said that there will be a specified area designated in Sham Shui Po. How many buildings without owners' cooperation, etc., and how many of them have poor environmental condition? And can you explain to us that without a localized lockdown, how can your compulsory testing be effective? You said that of the 37 buildings under compulsory testing, there are about 13,000 people who have been tested. But what is the denominator? If you don't know the total number of people who live there, how can you give us an assurance that what you have been doing are effective in controlling the epidemic? For Hiu Feng House and previous incidents, say for example, sea crew, it's only after something happened that you took action, say for example evacuation. Well, how did you assess the situation? What else could you possibly do to restore confidence to the general public? Let me start with Yao Chim Wang area. Within the specified area, there are a lot of private buildings. As I've said, we have little information about these buildings because they don't have owners' corporation, management company, or resident associations. So we don't know how many people living in how many households in these buildings. The district office has been doing their work to do door-to-door. They also make use of ethnic minority groups they are in contact with. To reach out to ethnic minorities living there to get tested. We need people who speak their language to facilitate communications. We need people who speak the language at different posts to facilitate our work. We might be able to get a glimpse of the trend, but from the number of cases and the changes in number. We've also enhanced our tracing. Tracing and testing are tools to help us identify related cases as soon as possible. I can't really recall what's your question about Sham Shui Po. How many buildings are there in Sham Shui Po that are poor in environmental hygiene and without owners' cooperation, etc.? The district office are very familiar with that area. They've given us their input in the specified area. We have enhanced our testing capability and our contact tracing capability. For South Asians, some of them are from the quarantine centers. They are students and construction workers, as well as housewives, those who have a job, are working in NGOs, cleaners, security workers.
From the South China Morning Post, two questions for Dr. Cui first, and the last one for Dr. Chuang. At yesterday's press conference, health officials' remarks about the behavior of ethnic minority groups during the outbreak caused a lot of distress and outrage among the community. Will the government admit that those remarks have been unfair and insensitive, and will authorities apologize for making those comments? Second question is that the government is only establishing a core area in Yaojiwang district now. So was the government too slow in responding to the initial outbreak there in the district, which has led to such a widespread one right now? And my last one for Dr. Chuang is, you mentioned earlier that the 5 people who gave wrong phone numbers have been found now. So how likely could those 5 people cause more transmission in the community before they were found? Thank you.
Since the outbreak of COVID in Hong Kong, I think the government or the Center for Health Protection has reported different kind of clusters. For example, those happening in meal gatherings, in religious premises, in workplaces, for example, terminals, and also construction sites, and also in different buildings. So there are different clusters that we have mentioned, and this particular cluster in Yau Ma Tei district is also rooted from somebody, partly at least, partly rooted from those who are working in different construction sites. So by naming particular group of people, we definitely have no intention of labeling different group of people. As I mentioned before, we have classified or reported so many different other clusters, and we also use the same approach in identifying the features leading to the risk factors of spread in various clusters. So that is the strategy. One of the strategy is to know the characteristics of particular clusters well and define the actions to take forward to control the spread. So that is the basic principle. For the Yau Ma Tei area, I think we, after knowing the number of cases and the background more, for example, their social behavior, the occupational background, etc., and also the building environment that they are living in. So that is why we set up the specified area, and we have identified, or we have collected more than 12,000 specimens, and of course we are going to enhance the testing strategy by confining a core area, which we will impose compulsory testing even the building has no confirmed cases, to intensify the testing. Thank you.
For every confirmed case, we'll ask for the date of testing or date of onset of symptoms. And then the 2 days before onset of symptoms will be classified as a communicable period. So once we isolate them in the hospital, we'll ask all these movements, and whether there's any close contacts, we'll put them under quarantine.
好，下一個提問係呢邊大帽呢一位。
The person over there. I'm from Oriental Daily. I'd like to ask about the 70 buildings included in the core zone. Do you know how many people that would involve? Well, as you said, you're not imposing a stay-at-home order. So how efficient would such testing be? And would other areas also be included in the specified area nearby? Would you consider extending these social distancing rules all the way up till Chinese New Year? You said previously that you were going to look into family gatherings and maybe banning family gatherings. How have you completed the research? In future, the buildings in Yau Chin Wang will still be in poor management. And how are you going to stop it from further transmission? And I would also like to know about the case number for the doctor who contracted the virus in North District Hospital. I'm sorry, you spoke very fast and I wasn't able to jot down all the questions. Could you repeat the question? Yeah, do you know how many people are involved in the 70 buildings in the core zone, and would other areas other than Sham Shui Po also be identified as a specified area, and how efficient would it be if you do not impose a stay-at-home order? Thank you. I will first answer this question. we are adding in more numbers of buildings as we know more about the area. The preliminary testing order targeted about 70 buildings. And I think about 2,100 people from those buildings underwent testing. And altogether, I think we reached out to 13,400 people in the area. Well, we are not able to identify the exact number of residents in those buildings. Therefore, the district office has been knocking on the doors of the units and going around explaining to the residents about the situation and requesting them to undergo tests. We have explored the need on compulsory testing. We see some characteristics in the area, which is the area is a bit old and many of the buildings are standalone buildings with poor management and not very well kept. And we decided to focus on the area. Therefore, we can also try to test this out in the areas to see whether it would be more efficient. The doctor from the North District Hospital is confirmed with case number 9691. Well, the second question was on whether you are going to extend all the social distancing measures all the way till Chinese New Year. And were you exploring the ban on family gatherings? I also like to ask about the follow-up arrangements for the 3-nil buildings. Well, the 3-nil buildings is not an easy issue to resolve, and the government will continue to look into the situation. The pandemic is still not yet under control, and we do not believe it is appropriate for us now to relax the measures. I understand that everyone wants to meet with their families during festive periods, but we need to stay vigilant, especially in areas where there is poor ventilation. The last two questions. Hello, I'm from AM 730. I'd like to ask about the specified area in Yau Chim Wong. Do you have a number on confirmed cases for those who have taken the compulsory test? Are you also going to extend the area to further to a larger boundary? And shops would be affected in those areas. Would the government provide some assistance or subsidy to the shops affected? In the past 14 days, how many buildings have seen confirmed cases in the Yau Chim Wong district? Are there areas or buildings with more cases? And how did you come to the decision with this boundary? I want to ask how many houseboats have been evacuated from the Unit 1-3. Well, the specified area in Yau Ma Tei will be as set for now. We have not thought about extending to other streets yet. some shops may be temporarily affected, and we apologize, but this is only for a short period of time, so there would not be any compensation. In Shamshui-Po, I have already talked about consideration because of the poor managed buildings and 3-0 buildings. We may not see many cases before coming to a decision on imposing compulsory testing, because we also look at the environment.
Regarding Hill Fong House, is that unit is a few floors above the 12th floor. I don't have the figure because some of the units have been sold. Just slightly above 12th floor. For the preliminary positive is yes, slightly above 12, and the confirmed case is not unit 13. It's above 12th floor. Last question, the one in white. I'd like to ask about specified area in Jordan. Dr. Chuang said that 31 cases live in Yau Chim Wang. You mean the specified area in Yau Ma Tei, Jordan? There are 31 cases. A number of reporters have asked a similar question. Now there is a decision made by the authority. There is a core area designated within the specified area. Is it based on comments and advice given by the district officer? Is it the case that, well, if it ticks a number of the boxes in criteria, then it will fall into the core area? Just now, it's mentioned that there are store owners and markets. Would you advise them to cease operation for a period of time? Will you propose any measures to help reduce the amount of footfall? 31 cases, the entire Yau Chim Wang district. 15 is within that specified area. In relation to the specified area in Yau Ma Tei area, is because of a special situation. There has been quite a number of confirmed cases, and the buildings are very close together. That's our first decision. The government has decided to tighten the criterion. The number of units has been reduced from 2 units to 1 unit under the compulsory testing notice. We aim at increasing the testing rate in order to identify more confirmed cases. We are considering whether to review the situation. Say, for example, the sewage surveillance system. It is being conducted in tandem. It's conducted by a team from the Hong Kong U. Well, for related buildings without confirmed cases, there are positive results found in the sewage of the building. We want to make use of different means. We would like to further tighten the criterion. For buildings without any confirmed cases, we would like to get the residents to be tested. So that is on top of the sewage test surveillance system. And the specified area. If we think, based on the information given by the district office, that compulsory testing is required, then we will roll it out. We're talking about areas that is buildings that have got poor hygiene. We advise members of the public to not stay in poorly ventilated areas. We would like to engage people who speak their language or know them to advise them. Last question from the person in white. I'm from Ming Pao. How many buildings are there in the specified area in Sham Shui Po that fit the bill? Can you give us the list of buildings? Can the Undersecretary explain? Now there is a specified area. Within that area there is a core area. It's rather complicated. Wouldn't it create communication problems? Members of the public may not easily understand why it's done and how it's done. And what is the difference of risk between the core area and the specified area? If you are unable to explain the basis of this extra decision, it will give us the impression that it's arbitrary. People do look forward to seeing their family in the Chinese New Year. And the latest measures, say for example, no dining in the evening as well as 2 persons a table, have been in place for quite some time. When will these measures be relaxed? And I'd like to ask about the North District Hospital doctor. How many people has he been in contact with? Number of patients, healthcare workers, how many people in the wedding that is attended? And what about the case from Sha Tin Hospital? We decide to launch to designate another specified area in Sham Shui Po. So within that specified area, any buildings with one case will have the residents will have to be tested under the compulsory testing notice. As I explained, when the idea was conceived for a specified area in Yau Ma Tei, it was because of outbreaks and clusters. Some of the cases live very close together, and because of the behavior of the community, there is a very high risk of cross-infection. That's why we think it is necessary to increase the testing rate. We consider different ways to increase our test rate. In certain areas, there are some buildings that require extra attention because of the conditions these buildings are in. That's why we've decided on this core area. Buildings with no confirmed cases, residents of buildings with no confirmed cases in this area will have to get tested as well. This is another approach we've adopted to increase testing. I understand that we have all been fighting the epidemic for a very long time. It's understandable to feel fatigue, and it's understandable that you feel the need to have human interaction. And in the second or the third outbreak, we have set the criteria for relaxing social distancing measures. Say, for example, single-digit confirmed cases for a period of time. We think that we're still some distance away from that situation. It is premature to talk about any possible relaxation.
關於北區
As for the confirmed doctor from North District Hospital, we have already set a press release. There are 3 close contacts who are colleagues, and there are no patients who are close contacts. For the 2 confirmed colleagues, for the person working in Yaomate GOPC, that person lives in Yaomate but not in the specified area. As for the colleague working in New Territories, right now I do not have any information. Thank you.